Assalamu alaikum everyone. Today I will be talking about the Tokyo guidelines for the treatment of acute cholecystitis. And grading is done before the treatment of acute cholecystitis. We decide whether an early, elective, or an emergency cholecystectomy has to be done. An early cholecystectomy is usually done within 5 to 7 days of the onset of the symptoms of acute cholecystitis, whereas an emergency cholecystectomy is done immediately when there are symptoms of cholecystitis. And the important thing is that we have to determine whether inflammation is present or not. And when there is inflammation, then an early cholecystectomy is not indicated. Whether the patient has to wait for like 6 weeks before the inflammation goes away, and then the operation of cholecystectomy is done. So first of all, we will look at grade 1. In grade 1, there is acute cholecystitis without inflammation in a healthy person with no organ dysfunction and inflammatory changes in the gallbladder, making cholecystectomy a safe and low risk operative procedure, which means that an early or an emergency cholecystectomy can be done. Coming to grade 2, in grade 2, we must see that there is an elevated WBC count, more than 18,000 cells, and a palpable tender mass in the right upper quadrant of the abdomen, and the duration of complaint is more than 72 hours. Marked local inflammation, gangrenous cholecystitis is a common condition in which inflammation occurs. Pericholecystic abscess and hepatic abscess, biliary peritonitis, and emphysematous cholecystitis are conditions in which there is local inflammation. So the cholecystectomy is delayed when there is grade 2 of acute cholecystitis. And then coming to grade 3. In grade 3, there are multiple associated dysfunctions in the patient, which include CVS dysfunction. The patient is hypertensive and is receiving dopamine and epinephrine. Dopamine is basically in the amount of 5 milligram per kg per minute. More than that, which is the reason the cholecystectomy has to be delayed. So it is one of the CVS dysfunction, whether the patient is receiving dopamine and epinephrine, and uh, uh, the neurological problem is lack of consciousness, and in respiratory, the partial oxygen compared to functional oxygen capacity ratio should be less than 300. And in the renal oliguria, there is oliguria, and creatinine is low, less than 2 milligrams per deciliter. Sorry, more than 2.0 milligrams per deciliter. The hepatic dysfunction is that the prothrombin time is increased, PTINR is increased, and the hematological platelet count is less than uh, 100,000 platelets. So these are the dysfunctions, that associated dysfunctions, which we uh, are classify as grade 3 of acute cholecystitis, and the cholecystectomy has to be uh, delayed in such patients. So this is the brief summary of the Tokyo guidelines. Thank you.